Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. All right, Mr. Anthony, thank you for joining us. Could we, as usual, get an update on our current vaccination numbers?
Well, thank you very much for having me on this program. As of yesterday, we have had 232,599 persons receiving their first dose of the COVID vaccine. That would be approximately 47.8% of our adult population. And for those receiving second dose, we've had 107,421 persons. This is now 22.1% of our adult population.
All right. Thank you, Minister. I know that we have seen some hesitancy in communities across the region. Can you tell us how the regional campaigns have been going and if there is additional need for COVID curb on the ground?
Well, COVID curb is different. COVID curb was working to help people to understand the public health measures that we have in place. And they were looking more at encouraging people to wear masks, encouraging people to do social distancing and sanitizing their hands. This is all public health measures that I guess everybody now is familiar with. We, however, have been working on improving vaccination, and there are lots of myths that people would harbor about vaccination. These include persons not understanding how vaccines work. They question the efficacy of vaccines. And more recently, you have some political parties who have come out openly against vaccination. This has caused a setback. In addition to myths that people harbor, now that you have a vocal opposition telling people not to get vaccines and calling for the suspension of the Sputnik V vaccine in Guyana, has in some ways contributing to people becoming a little bit hesitant. So it's making the work of the health workers extremely difficult to try to undo the damage that was done by the opposition. Nevertheless, the professionals that we have on the ground has been working to make sure and to get people to understand the importance of vaccination. So apart from us now having fixed sites in the different regions, what we have started to do, we have started to do some house-to-house, going to the various communities, walking from house to house, talking to people, and encouraging them to get vaccines. We have also, on those outreaches, have vaccination teams that would be mobile so that as they go through the house-to-house exercise, if there are people who would like to get their vaccines, that they would be able to get it right there. So we're working on different approaches. We have seen a slight improvement in the numbers in Linden. We would like to see those numbers go up, and we have to continue to work with community leaders in Linden to make sure that there's a better understanding and appreciation of how vaccines work. We have in Regions 1, we have taken the house-to-house approach now. In Region 10, we've had some exercises with house-to-house. That would have to continue. In Region 9, we are doing the same, going village by village, trying to get more people vaccinated. And in some of the other regions on the coastline, most of the RHOs and their team have adopted this approach. So we have fixed known sites where people can come, and we have the house-to-house approach where we are going into the communities and trying to talk to people. In addition to that, we have been working with a number of workplaces and trying to get those work sites to organize vaccination campaign, and we go to those sites and offer vaccination. So this has also been working, and We are working also to put together a set of initiatives where people would be rewarded if they get their vaccines, and this we're working with the private sector to see how we can get these initiatives rolled out. So I think by and large we are working now to counter the negativity that was caused by the opposition and to still encourage people to dispel whatever myths they have and to encourage them to come out and get vaccines. Guyana would not be safe until we have a lot of people getting these vaccines. We have to strive to get at least about 80%, 85% of our population being immunized, and we're still a far way from that. We have vaccines. What we have to do is to ensure that people come out and get the vaccines.
Okay, sir. My next question is specifically to do with the Sputnik V vaccine. So we're aware that there's a delay in the second dose, and we know that the second dose can be administered anytime between 4 to 12 weeks. Can you say what happens if the 12 weeks exceeds, if we go past that and we haven't gotten?
So first of all, no person that we have administered Sputnik V as first dose would have gone past 12 weeks. So they're still within the time period when they can get that second dose. And after your first dose, your efficacy is generally about 79% after a single dose. And when you get that booster shot, in between the 4 weeks to 12 weeks, when you get that booster shot, it goes up to about 97%. So even without the booster shot, if you get a single dose of Sputnik, the first dose of Sputnik, you will still be protected. There was a study that was recently published by the government of Argentina on the 7th of June. And in that study, what they have done was to go back and look at the efficacy of Sputnik single-dose vaccines. And they found that it was, with one dose, you had about 79% effectiveness protecting people against infection, and it was 88% in preventing hospitalization, and this is just a single dose. So the point here is that we do have a single dose, well, we do have the first dose of the Sputnik vaccine that is available. I am encouraging people to go and get the first dose, and we are working to bring in the second dose, and you will get that second dose within the time frame that we've stipulated, and that is between the 4 to the 12 weeks. So we have to get people protected, and this is the only way we can get them protected. So let's encourage people to come out and get that first dose, because from this Argentinian study, you can see the powerfulness, the effectiveness of a single dose. But we are committed as a government of Guyana to give both doses. And we are working with the suppliers to make sure that we can get those second doses in. And as soon as we get them, we will distribute them across the region so that people who are waiting for their second doses can get their second doses. In the meantime, we also have the AstraZeneca vaccine. We are giving these out at all our sites, first and second dose. So if you haven't taken any vaccine and you would like to get the AstraZeneca vaccine, then you should come to one of our sites and you would be able to get that. We are also recommencing the giving out Sinopharm vaccines. And again, we have both doses that are available, so those who still need to get their second dose can get that. And we are now going to start doing the first dose of the Sinopharm. So there's no excuse why people shouldn't come out and get their vaccine. Vaccines are available, and we need people to come out and start the process so that they can be properly protected.
Okay, thank you. My next question for you, and we had discussed this before, so just bear with me. I just need a matter of clarity again for those persons who still are unsure. Why are we not mixing the vaccine?
There's a couple of reasons. One is that the manufacturers would prefer that you give the vaccine, separately. And the other really has to do with if there are side effects, then to which vaccine do you attribute the side effects? And therefore, manufacturers are quite reluctant to allow countries to mix vaccines. We have followed that guidance, and so if you get a first dose AstraZeneca, you're going to get a second dose AstraZeneca. If you get first dose Sinopharm, you're going to get second dose Sinopharm. These two vaccines that we have used, what you get for your first dose is the same thing you get for your second dose. With the Sputnik V, the vaccines are different. So what they refer to as the first dose or component 1 is different from component 2. So while we have adequate component 1, we are still awaiting the arrival of the component 2. And that's basically the difference. We have seen now studies that are emerging where people are mixing and matching. And we await to see the efficacies of the results from those studies to see how efficacious those programs have been. They are very limited data right now, but the data looks promising. But we'll have to see the scientific evidence before we suggest any change to the regime that we have. So we're not changing that as yet. We are holding to the original regime, which means that if you get Sinopharm first dose, you're going to get Sinopharm second dose. If you get AstraZeneca first dose, you're going to get AstraZeneca second dose. And if you get Sputnik V, then you get your first dose, and then we'll give you your second dose.
Okay, sir. I have one last COVID question before I ask you about the SID summit. So the last question is, there's been a new type of test to detect COVID-19, and that test is being called RT-LAMP. So can you explain what that test is to us, and what is government's position on accepting a negative result using this from anyone who may use this before they enter the country?
Well, first of all, I don't know how widespread this technique in terms of testing would be. But RT-LAMP basically means reverse transcriptase loop-mediated isothermal amplification. What that really means is the technique used for the testing has been varied slightly. The ones that we are currently acquainted with is RT-PCR, which is reverse transcriptase polymerase chain reaction. So this new, relatively new technique for COVID-19 tests has not been used in a widespread manner. But what it really does, because when you use the word isothermal, it means it's running the amplification at a fixed temperature, which is 65 degrees Celsius, which differs from what we do with PCR, where you have a variable temperature. But most countries now already have built the capacity to do PCR. So we have all the equipment to do PCR. And while this is supposed to be a simplification, unless the cost is going to be significantly less, meaning equipment and reagents, I don't see a lot of countries converting to this. So right now, as far as I'm aware, there's very limited use of it. And this technique is based on a color code. So it converts when you finish. If the test is positive, it goes from pink to yellow. And if it's indeterminate, it's going to be orange. But again, it's of very limited use right now. Some countries might prefer that. But what is the standard protocol that have been adopted by most countries in the world is to use the RT-PCR, which most countries now have the capability of doing, which has general acceptability, and that's what we are using. And to use antigen tests, and there's specific antigen tests depending on its sensitivity and selectivity that we have decided which ones we're using here. So our protocols as it relates to people coming into Guyana requiring RT-PCR remains in place, and those that that's our protocol basically, RT-PCR. And as more information becomes available on this new technique of testing, we'll have to see the validation of those results to see whether or not it can appropriately pick up variants and so forth before we would concur on its scientific merits, and then probably to change our protocol to allow it. But as I said, this particular technique is not widely used.
All right. As we're on testing, I understand that there is a new testing site set up at the Vredenhoopstelling. Could you tell us about that?
Yes, what we have done is at Vredenhoop, we have done both a testing and a vaccination site. And again, we know that there's a lot of foot traffic going through by the Stelling. People using the speedboats to get across to Georgetown and come back home in the afternoon. So we thought that would be a very good catchment area for persons who haven't got their vaccines or were too busy during the day, but when they come home in the afternoon, they can stop in at the vaccination site and get their vaccine. And if there's a necessity to get tested, we can do the test there as well. We are hoping later on we'll be able to put up a similar site at the Parica end. And again, people who are coming in from the riverine communities or the Escriba coast, if they need to get vaccinated or to be tested, as they pass through that gateway, they'll be able to access both testing and vaccination.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.